Bispecific antibody is one of the more promising options for treatment for patients with diffuse large B-cell lymphoma. We have results, encouraging results of these bispecifics that obtain high response rate in heavily pretreated patients with diffuse large B-cell lymphoma. But maybe one of the key questions now with these therapies, if the response that are achieved with these bispecifics are maintained. So particularly complete response, if some of these patients could be potentially cured by these therapies. And yesterday, I want to highlight the work that was presented with Glofitamab that evaluated the response duration of patients with complete response with a dose-limiting treatment with Glofitamab, a bispecific CD20 anti-CD3 antibody. And in this work, with a median follow-up of CRs of around 18 months, most of patients that had a CR after the treatment maintained the CR. So probably, I think this data is important, and probably some of these patients could potentially be cured by the bispecific antibody. Still, I think we need some more follow-up to be sure about that, and probably next update of the result would be important to have the whole picture of the duration of response with Glofitamab. Beyond Glofitamab, yesterday also was presented data from Odronextamab, another anti-CD20, CD3 antibody. So along this year, we had the phase 2 data from Glofitamab and Epcoritamab, but for the first time, we have data from Odronextamab from the phase 2 results in diffuse large B-cell lymphoma, already with a phase 2 dose with 160 milligrams of Odronextamab, and with an optimized step-up dosing to reduce the acute toxicity of the bispecific, particularly the CRS with the bispecific, and showing also encouraging results in heavily pretreated patients with DLBCL, with CRs above 30%, including both patients with, that have been previously exposed to CAR T cells. So, and finally, I think bispecifics also, it's a kind of therapy that can be combined with other therapies and with chemoimmunotherapies. So probably it's a different mechanism of action, and the manageable safety profile of bispecifics makes them suitable to combine with other treatments. So yesterday we presented results of Epcoritamab, a subcutaneous anti-CD20 CD3 antibody, combining Epcoritamab with RDHAX or RDHAC in patients eligible for autologous stem cell transplantation. It's the first study combining a bispecific with a chemoimmunotherapy regimen in patients eligible for autologous stem cell transplantation. And the response rates of this combination were high. Also, the safety profile was manageable, and it's in the response are durable, although the follow-up is still short, and we will need a longer follow-up to confirm the results. So, and finally, I think these bispecifics are moving to early lines of treatment. And today we will see the results of some of them moving to frontline. We will see data of Glofitamab plus R-CHOP in frontline, data from the phase 1b study of Glofitamab plus R-CHOP with more than 50 patients treated with this combination in frontline. And also some interesting data of Mosunetuzumab, another anti-CD20 CD3 antibody, as a monotherapy in frontline for those patients that are elderly or unfit to be treated with standard R-CHOP, and be an option for these difficult to treat patients that are not fit enough to receive a standard R-CHOP treatment.